All right, guys, week number 2 is the knee joint. Last week we talked about the ankle, which is a really big mobile joint. The knee we consider more of a stable joint or a slave joint. So the hip and the ankle, opposing joints from the knee, do a lot of movement. And most of the time, injuries that occur to the knee joint are due to a lack of mobility or a lack of strength in either of those joints, above or below it. So what we're going to do is try and tackle some of the weaknesses and the imbalances that people have with the knee joint, most specifically the upper legs, the quad, the hamstring, that kind of thing today. You've got someone who comes in off the street, they typically sit down a lot. More than likely, they have an underdeveloped posterior chain, hamstring and glute complex, and an overdeveloped anterior chain, so quads and hip flexor. Before class, we're going to try and attack foam rolling or inhibiting that tight and overactive tissue. So with the foam roller, I want them to hop on, do about 1 minute to 2 minutes of rolling. If it's too hot, they can use both legs at the same time. Otherwise, they can hop on just one. And they should move from the medial to the lateral aspect. We can roll up and down, or if we find a hot spot, we can stay there and rock inside and outside as well. Once we've turned off that joint, we need to lengthen it. It's the next step in the process. So we can grab an ab mat or just use a wall, and we're going to pull that heel up towards the butt and try and stretch out that quad. The nice thing about this stretch, like a couch stretch, is that we can also open up the hip flex as well, which tends to be too tight for people. Once we've held that for 1 minute or 2, we're going to have to try and activate the underactive musculature, so the glute and the hamstring. You can do that really well with a band. Just step on that sucker, put it over your shoulders, and we can do a banded glute good morning, excuse me. So hinge back, sink the hips as far back behind the body as possible, and then activate those hamstrings and glutes by squeezing forward. Once we've turned them on, we need to go ahead and strengthen them. So if it's a big hinge day, we definitely want to turn off the quads first. If it's a squat day, we're going to also foam roll and stretch the quad out a little bit, but we really need to focus on activating the hamstring and the posterior chain. So that way we can teach people how, whether or not they're squatting or maybe doing a kettlebell swing, how they can utilize that posterior chain for a bigger percentage of the movement. Once they're done with that, you know, maybe they are done with the workout, they get some soreness, some tenderness, they can use any one of these tools, the ball, the rumble roller, and we're going to try and reduce the soreness after the workout. So they're going to try and foam roll or myofascial release that hamstring again. Again, we're just trying to find that hot spot, spend some time in there, 30 seconds to a minute of really attacking one particular spot. And then we'll again lengthen out that quad after the workout. Same drill, or if I don't have an ab mat, I can just hang out by the wall. For our members that aren't actively in class today, we can also do some really good drills out on the gym floor. We can do the hamstring curl, whether it's prone, seated, whatnot. We can go ahead and strengthen that up and activate the muscles just there, regardless of whether they're in Gold's Fit, maybe they're on a vacation in a hotel gym or something like that. If on the off chance you do get the random person who has an underactive quad, maybe they've had a tear or maybe they've had like a knee surgery, something like that, and they do need to activate it, a really easy drill they can do just to try and turn on and stabilize that muscle, put the foam roller directly below the knee and just activate that quad isometrically so they're not doing a lot of active range of motion. As they start to get better at this, we might put them on the leg extension or maybe some really small partial range of motions for squats.